number of years, we have been talking about climate change. And climate change is mainly manifested in such issues such as flooding, drought, abnormal rains. And what we have not been previously doing is to link climate change to health. Mm-hmm. But if you look at, for example, the last 3 or 4 years, we have been experiencing frequent disasters that are related to climate change. Mm. And these disasters are having implications on health. For example, just look at what the country has been going through in the last 1 month or so, mm-hmm. where the flooding. So flooding is likely to be linked to waterborne diseases. Mm-hmm. And as you know, we are likely, or we experience cases of cholera. So cholera at that point was a result of climate change. If you look at about a year ago, we had drought in Kenya. So what happens when there's drought? Mm-hmm. Number one is that there's food insecurity. People are not able to get the diet that they're supposed to get. And therefore we have issues of malnutrition. So that's a case of a health issue being directly related to climate change. Mm-hmm. So the frequency in which we are having climate change in the country and even across the globe is causing implications on health. And therefore, there is need now to look at the climate change and health nexus in order to bring up solutions to this issue in a multifaceted way. Mm-hmm. Yeah.
So maybe you can tell us how effective are current policies in Kenya in addressing these now climate-induced disasters?
So what we are observing, or what is currently happening, is that we have climate change actors and we have the health actors. So what we are observing is that these two actors or these two institutions have been working separately, mm-hmm. not in collaboration, and therefore we do not have policies that directly link climate change and health. And this is not just specific to Kenya, but it's also happening across the globe. Mm-hmm. So it's because of the issues of the frequent climate change related disasters that are now bringing this discussion on the table. Mm-hmm. So it is important that you have this discussion so that you can try to minimize the impacts of climate change on health. Mm-hmm. Yeah.
Tell us about who are the most affected in terms of now, when climate change, floods, for instance, droughts, who are the most affected health-wise?
So the most affected are the vulnerable. Now, look at this. A year ago, or 2 years ago maybe, we had drought in the country. Mm-hmm. So one of the communities that was affected by the drought was a pastoral community. There was no pasture for their animals. Some animals died. Mm-hmm. And these animals are their direct livelihoods. Yet these communities have less ability to adapt to climate change. Mm-hmm. Again, look at what has been happening this year, the flooding issues. So most of the communities that are living in prone areas have been directly impacted by the flooding.